Hello, my name is Hailey Weidman, and I am currently a graduate research assistant at Texas A&M University. And today I will be discussing pre-breeding vaccination timing and the differences between inactivated vaccine usage and modified live vaccines. So firstly, we are going to be discussing the common components of vaccines, with the first being active ingredients. These are your viral or bacterial antigens that directly stimulate the immune system but cannot cause disease. Adjuvants are typically also included in vaccines and are often as aluminum salts in small quantities that help to boost the immune response to the vaccine. Antibodies are also included, which help prevent contamination by bacteria during the vaccine manufacturing process. Stabilizers often are sugar and gelatin, which keep the vaccine effective until it is administered. Preservatives, often as gentamicin, prevent dangerous bacterial or fungal contamination. And there are additionally trace components, which are in small quantities that do not pose a safety concern to your kibble. So there are differences between inactivated vaccines and modified live vaccines. Inactivated vaccines use killed forms of the virus that cannot replicate to cause disease, but they do often require a booster at approximately 28 days after the first dose to improve efficacy of these particular vaccines. These vaccines are typically able to be administered during pregnancy as they do not provoke that stronger immune response. Modified live vaccines, on the other hand, are weakened forms of the live virus that create a longer lasting immune response, but are not typically administered during pregnancy, as these vaccines have been shown to cause abortions if they do not have fetal protection agents in them. Recent research in this particular field has been conducted looking at the differences between inactivated vaccine usage and modified live vaccine usage pre-breeding on fertility status and conception rates. So I would like to draw your attention over to the right hand of the screen to look at the table I have presented for you today. So looking down, you can see at 40 days, there was a statistical difference between those animals that received that inactivated vaccine, represented by IVV, and those animals that received that modified live vaccine, represented by MLV. On 40 days, animals receiving that inactivated vaccine had a pregnancy success rate of 53.7%, but those receiving that modified live vaccine had a success rate of 40.6%, showing a statistical difference on that particular day between the vaccine treatment groups. Going down to 60 days, we can see that statistical difference occurring again, with those animals receiving that inactivated vaccine having a success rate of 50.8%, with those receiving that modified live vaccine having a success rate of 34.6%. So this leads me to the impact on cyclicity status that modified live vaccines have. Modified live vaccination has been shown to negatively affect circulating progesterone concentrations, and when progesterone concentrations fall below a certain threshold, large luteal cells on the ovary are not able to produce the proper quantities of progesterone to properly cycle or maintain a proper pregnancy. Therefore, pre-breeding vaccination should be administered at least 45 to 60 days prior to artificial insemination to allow the reproductive system to heal post-vaccination. As timing is key because at the end of the day, you want a healthy cow and a healthy calf to allow that cow to be enrolled in the next lactation cycle without any issues. Thank you for listening to my talk, and I hope you learned a little bit about the impact of vaccination on reproductive success.